Kathy Burden is a client of Heights of Health. Good morning to you, and thanks for joining us this morning.
Thank you for having
First of
me.
all, tell me what you were diagnosed with when you first started going to the Heights of Health.
I had latex allergy, type 1 and type 4. Type 1 is an anaphylaxis response. I was a breast cancer survivor, and I had been diagnosed with myotonic muscular dystrophy.
How the ladies at Heights of Health describe you when you first came there is they said you could barely get in the door. You hobbled in, you had leg braces, you had arm braces, you were on 5 medications. You walked in here perfectly this morning, no
Yes,
braces,
I did.
and you're on no medications now.
No medications. I take supplements to help nourish my body, but no prescription drugs.
How dramatic of a life change has this been for you?
It's been extremely dramatic. We've been able to do things with our children and our grandchildren that I couldn't do before.
One thing that I think is particularly interesting in your case is the fact that your medical doctor told you, I really think that we're at the end of the ropes with Western medicine. It can't help you. You need to seek alternative care. So your medical doctor is the one who suggested you seek other care.
Yes, she did. We had been trying to figure out how I could lose the weight that I had gained from my cancer medication. I had gained 65 pounds, and I was a compliant patient, and I wasn't dropping any weight. So she decided that this was the route that I needed to go.
Let's walk our viewers a little bit through how you were treated there, because they may just be scratching their head and say, okay, how did you go from having this disease to doing so well today? So from what I understand, they have technology, and we have some video that we can show you to help walk you through this, that you see right here, and they're the little paddles that you hold in your hand. That was technology that was created for NASA, for them to analyze moon rocks. However, these brilliant scientists tweaked it to read our human body. That way they can kind of get an idea of what's going on in the body. And then there's just a simple, I understand, non-invasive technique they use that helps clear the bodies of some of these problems.
Yes, I was a little bit skeptical at first because it was something I had never experienced before, but it is non-invasive. You hold a vial of the product or material that you're allergic to, and they clear you of this allergy. And amazingly enough, it started working immediately, and so as we progressed week by week, I got better and better.
When you're talking about an anaphylactic reaction to something like latex, your life is on the line at any given moment when that product comes into the room with you. Have you been around latex now? Do you still have those fears? I mean, she said that they will never say they can clear an anaphylactic because they have to be very careful with that. But how is your comfort zone around latex now? My
comfort zone is much better. I couldn't go anywhere without somebody going with me for fear that I would have an anaphylaxis reaction. The 911 would be called, the EMS would show up and put their latex gloves on. So I always had accompaniment with me, but now I can go places. I know the places to avoid, and I feel safe and I feel okay now.
You also had a CPAP machine before you went to the Heights of Health, and you no longer have to use that as well?
Use it, yes.
So you've had just some major differences in your life. Your quality of life must be so much better.
It's a lot better. We're enjoying life, we're enjoying our grandchildren. And
I talked to and interviewed your doctor who suggested that you seek other care, Dr. Ugolini. She was an incredible woman. We're going to hear from her in just a moment. But what she wants to happen with procedures like you've been through is she wants there to be medical, absolute results to show that this works. And you're trying to start a study with the owner of Heights of Health to make that happen?
Tracy and I have been working with Methodist, the muscular dystrophy group, trying to get a study put together. We're trying to get funding. We think we're at the very end of this procedure and that we'll be able to do the study. So there's great things on the horizon.
Sure, and when something like that happens and it becomes more accepted in all medical fields, don't you think that even more people can be helped from this, because people won't be scratching their heads and say, nah, there's no way that could work? Absolutely.
I think that the human body is geared to heal itself, but your body has to have a start. And when I went to see Tracy at first, I was so sick that Western medicine had exhausted all hopes. When I got to Tracy, the first thing she told me was that I needed to be hydrated. I needed to have proper nutrition, and I thought I was doing all of these things to the best of my ability, but as she educated me and showed me the things that I needed to change or improve, my health began to rapidly improve.